Locked bucket handle tear of the middle meniscus. It has to be reduced. A pie casting has to be performed, and now we can see that there is a large tear which is extending from anterior to posterior. The EcoStitch is the recent most innovative device which can help us repair these kind of bad tears. This device is based on a inside out needles. The needles are loaded with anchors which can be deployed sequentially. So there are two needles, both of the needles are loaded with different colored wires. One wire is a green wire and the second wire is the blue wire. Both of the wires are loaded with anchors. So when we pull these wires, we can see the anchors coming into the picture. So here you can appreciate that when we pull the green and the blue threads, two anchors are there in the vision. Then we pull the anchors slightly to deploy them beyond the capsular layer. Once it is deployed beyond the capsular layer, there is a pre-tied knot which is tied, and if you wish you can do one or two half hitches to secure the knot security. The first knot is put in the posterior part of the medial meniscus. Then we can just cut the threads that we have put. Then we will be using the second anchor. The second anchor is placed on the middle part of the meniscus. Now the important thing here is that the cannula that we are using in this particular case is a slotted cannula, and it is very important technique wise to remove the threads from the slot of the cannula so that the two threads, the green and the blue threads, don't intermingle with each other. So here we can see that there is a little bit of intermingling, but when we pull it, we are able to separate these two. So when we can see here that we have deployed again both the green and the blue anchors into its position, and when we pull the knot, the meniscus is actually reduced into its reduced position. So we can see a very nice repair of the middle part of the meniscus. So normally for these bucket handle kinds of tears, if we are using a EcoStitch, 3 anchors are sufficient, one for the posterior, one for the middle, and one for the anterior part. Now the strength of these suture anchors is very good because the suture which we are using here is a number 0 suture, which is much thicker than any other all inside meniscus repair technique which is available. The second advantage is the pull out strength is also very good because the hole that the needle makes into the meniscus is very small. The holes that the needle make in the meniscus is only 0.8 millimeters, which is very small as compared to the conventional 1.5 or 1.7 mm hole which is made by the standard all inside suture repair devices. So here we can appreciate that the anterior part of the meniscus is repaired again with the help of the EcoStitch. You tie it back into its position. Again you can make 1 or 2 knots to make the knot security, and then we can just do 1 or 2 cycling motion of the knee to confirm the repair and the repair stability. Here we can appreciate that after all the 3 EcoStitch devices are deployed, we can see a very solid repair of the meniscus into its position. We can see that the final repair is very good. It is almost looking like a normal meniscus, and this will do a very solid repair of the meniscus with an all suture technique. Thank you.